Hi, we're the Note Ninjas. I'm Stephanie, the PT, and then we have Nicole, the OT. Today we're going to show you a couple exercises for posterior chain. So we're going to link the article below, but it's been shown posterior chain exercises really help with chronic low back pain. Not to mention, working the posterior chain, your glutes, your hamstrings, your back extensors also help with stability, with balance, with all kinds of different issues. So we are going to start with the kettlebell swing. So we're going to show you a couple exercises. The first is a kettlebell. We're going to use a dumbbell. It doesn't matter what you use. You're going to pick it up, and you're going to just have your patient swing it back and forward, just like this. You can swing it. Even if they need to modify, you can really hold on and do a one-arm kettlebell swing. I mean, if they're really advanced, they can do it without holding on. And that also works as one side, so it really gets your core as well. And while they're doing these swings, make sure you're cueing them. Cue them to bring their hips back, bring their glutes towards the wall, to bend just from their hips and not bend forward on the upper back, to keep their head up and not go all the way forward or look all the way up, to keep a nice, steady body. That's the first exercise. The next one is we can just do a good morning. And this is a little bit more simple than a kettlebell. You can have them cross their arms across their chest, sometimes behind their head, and again, just bend from the waist and then come back up. Bend from the hips and come up. And make sure when they come up, they're squeezing their glutes, because that's really when you feel it. So come down from the hips and squeeze up from the glutes, keeping their chest up and looking eye level ahead. You could cue them. You could give them tactile cues on their back, on their hips, to keep their chest elevated. You can have a visual cue in the distance for them to keep an eye gaze. All these cues you can give to show your skill while working the posterior chain. And the next exercise we're going to do are a bridge. So have your patient lie down on a mat or on the table or whatever, knees bent, and have them push up into a bridge and back down. And make sure you're cueing them to show your skill. Make sure you're saying to push up through your legs, mostly through your heels, squeeze your glutes, and come back down. This is really working the glutes and the hamstrings. You could also progress it to keeping up and marching, or just holding it up there for a little bit, moving the arms. Great posterior chain exercise. And again, make sure you're cueing them what you're doing. Squeeze the glutes, push up through the heels, hold it up there, progress to maybe doing some holding or some pulses. That's a great posterior chain exercise. And for our next posterior chain exercise, we are going to cut to show you in the doorway. For this one, we're going to do resistance band pull-throughs. So I put a knot at the end of the resistance band. I'm going to close it in a door. You could also have hooks, or there's a lot of other ways to set this up, but this is the easiest with no extra equipment. Grab that. I'm going to put it down about knee level. Let's swing it in. Close it. Make sure it's closed nicely. You're going to put it behind. So you're going to grab it with two hands, and you're going to pull through. This really works the glutes and the hamstrings. And then make sure you're cueing your patient. You want to make sure they're hinging back. You could even give them a tactile or visual or verbal cue to put like their butt towards the door, and then squeeze their glutes on the way up. So you're going to hinge, butt back, and squeeze the glutes on the way back up. So we hope these exercises helped. Remember, posterior chain exercises are great for our patients. Besides the research that's below, it really helps with chronic low pain, back pain, which so many of our patients have, but also for that stability, the walking, the functional activities, the ADLs. So make sure to follow us, the Note Ninjas, for more skilled care tips and documentation.